Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today is Tuesday, June 30th, and this is my daily briefing. Missoula County currently has 42 active COVID-19 cases with more than 260 close contacts. A few of the active cases that we reported yesterday are now in recovery, so that number's dropped just a little bit. Active cases and their known close contacts are in quarantine and isolation, and they'll continue to be monitored and supported by medical staff as needed. There's currently one active hospitalization in Missoula County at this time. To date, we've had 92 cumulative positive cases. 89 of those are identified by testing and 3 were epi-linked, and we've had 49 recoveries and 1 death. The state of Montana is reporting 967 cumulative COVID-19 cases, of which 49 are new cases reported today. There are currently 12 hospitalizations across the state, and there have been 22 deaths related to COVID-19 in Montana. First, I want to let everyone know that we did not actually get 20 new cases overnight, as is reported on our website and the DPHHS website, but those are the cases that we got over the last couple of days, and we just needed to reconcile some of our numbers. Just a reminder that what we report on our website may be slightly different than what's reported on the DPHHS site, as they sometimes have a little bit of a delay in the data. That said, I do want everyone to take this sudden jump in cases over the last few days very seriously, as we are seeing an alarming number of new positive COVID-19 cases, and we're also seeing a significant increase in the number of people who are experiencing symptoms and are getting tested. Also, I want to thank everyone for your patience. Our 258 info line received so many calls yesterday that we actually overloaded the entire county telephone system. We believe that the problem should be fixed sometime today, so if you're trying to call to schedule a test and you're unable to get through, please be patient as we work through fixing the technology to better accommodate our call volume. Today, I'd like to talk about why we shifted back to our original testing criteria just 1 week after announcing our countywide sentinel testing plan and accepting appointments for asymptomatic people who have been in high-risk environments for COVID-19 exposure and transmission. The expanded testing criteria was part of an integrated countywide approach where a variety of community partners plan to strategically test different groups of people based on local implementation of the state's tiered testing plan. While the health department plans to serve a segment of the population, other providers plan to test and treat different demographics based on their level of exposure and risk. The strategic integrated approach distributes the testing across the county so that no one single organization is carrying the entire caseload. While all of our partners agreed to implement sentinel testing, we all understood that we would need to continually evaluate the data and use that information to guide our response moving forward. The health department announced on June 19th that it would start seeing asymptomatic patients that had been in high-risk environments like personal care workers, service industry workers, and others. During that announcement, we explicitly assured everyone that we would continue prioritizing testing of folks who are currently experiencing symptoms and their known close contacts. We were able to serve some sentinel testing patients last week, but due to the significant and steep increase of new active cases and their close contacts, we reassessed our strategy and needed to revise it. If we want to maintain pace with COVID-19 in our community while maintaining our healthcare infrastructure, including our ability to respond to current needs, as well as anticipated future needs related to COVID-19 and routine health services, which still need to happen while COVID-19 pandemic rolls on, it's imperative that we really pivot back to our original testing criteria. With 43 active cases and more than 260 close contacts, we now have more than 300 patients who are requiring some level of ongoing medical support for a minimum of the 14-day quarantine period. Here in Missoula County, we fully support all patients as best as possible. This includes having health department staff routinely checking in with patients, including both active cases and their close contacts, to verify their symptoms, develop and shift individual care plans as needed, and to connect people to care if their situation worsens during quarantine or isolation. We do have a finite number of critical resources like test kits and personnel. While we're working to obtain more of both, we're strategically using our resources to serve those most immediately affected by COVID-19, as well as those people who pose the most immediate risk for exposure and transmission, such as the close contacts to known active cases. While we had hoped to broaden our testing operations to include asymptomatic people, it's imperative that we shift our response effort in real time to the real needs by making data-informed decisions. Right now, the data is telling us that we need to roll back our sentinel testing plan just for now, not forever, in order to best serve those that are most affected and most likely to spread COVID-19, as well as to protect our health department staff and personnel and our entire healthcare hub, which provides more than just COVID-19 services, including routine medical visits and things like surgery or radiation or other medical treatments that might be necessary. This return to our original priority testing criteria also helps us to safely maintain pace with the increase in cases. Some of those data pieces that we used to make this decision included the high number of active cases, as well as a high number of close contacts who were notified by us that they were exposed to COVID-19 and they needed to get in for testing. It includes the increased workload for our public health resources to follow up with contact tracing and monitoring, and the significant increase in the number of people who are calling for testing that are already experiencing symptoms. This shift back does not diminish the fact that there can be asymptomatic spread in our community. We are continuing to ask folks to mask up for safety. The Missoula City County Health Department is one of several partners that are collaboratively serving public health needs across the county. If the health department cannot provide you with the services based on our current testing criteria, we can share the information with you about other options. Another option for people who have been in high-risk environments like those frontline workers is reviewing your workplace safety measures. This is really a good time for everyone to reevaluate your safety protocols and ensure that they're playing a part in protecting your internal staff and the external community, particularly in those high-risk environments like grocery stores, salons, restaurants, bars, and other sectors. Again, MCCHD at our testing location out at the fairgrounds is currently accepting appointments for people experiencing COVID-19 symptoms and their close contacts until further notice. If you are a close contact, one of our public health nurses will reach out to you and you will be notified in a timely manner, and then you'll be connected with testing services immediately. And just a reminder that the CDC did expand the list of COVID-19 symptoms a couple of weeks ago. So those symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches that are unexplained, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. We appreciate your engagement through public comment and social media interactions, and we're listening to you and we're taking your concerns around safety at this time very seriously. We do remain in conversations with our Board of Health about cloth face coverings and other safety measures that can reinforce the public's health. In the meantime, please mask up for safety. This is a small, yes, it's weird, but it is a minimally invasive, low-cost option to help protect others from your possible asymptomatic spread. So if you live here or you're visiting here, please respect one another and respect our local health orders. So with that, I just want to say thank you to everyone in the community for doing your part to help us protect each other and keep the spread of COVID-19 as manageable as possible in our county. That's it for my daily briefing today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so that you get notified when additional videos are uploaded. You can follow us on Facebook. We do post lots of great information there. We also have information there on the job postings that we have available right now. You can check out our website at missoula.co/cvirus for further information and guidance. We also post all of our numbers there. And you can call 258-INFO if you would like to get more information about COVID-19 or if you would like to schedule a test through our fairgrounds testing facility. So until tomorrow, everybody, stay healthy.